All right, guys, I'm gonna ask you to mute your phones. We have a couple of minutes before we start. Can everybody hear me? Hold on, let me. Can everybody hear me?
Yes, we can hear you.
Great. All right. How is it? Is everybody here from Replenish? 27 people. We'll wait. We'll give it like a couple more minutes. Who is Wanna Perkins? Hold on.
That's ready for you.
Okay. Okay, we're gonna start on time so we can finish on time. I'm gonna ask everybody to mute, or if you want to ask some questions now before we start, let's do it. Okay, so all right, cool. So we'll after the presentation before we ask questions.
For my laptop.
Yeah, I'm biting back I got a goddamn sand under that.
Hey guys, can you mute yourselves? I wish I was really cold at Zoom because I would just mute everybody. I don't know how to do it. So. We have 48 participants. Can you guys mute yourselves? Oh, hold on. All right. Great. All right, guys, let's I'm going to share my screen so we can talk about semaglutide.
Oh, hey, do that. I told you.
Yes. Can you how can I mute everybody? Hold on, how do I mute everybody? I probably should have figured that out before I Where's Sabir? Sabir, are you on mute everybody? Okay. All right, so let's talk about semaglutide. Well, welcome to Replenish. If you are not a Replenish MD provider, welcome to an organization dedicated to aesthetics and wellness. We're going to be talking about the wellness part today. Guys, everybody mute your phones or mute your Zoom. There's like 6 to 8 people in here, and I can't really 70 people in here, and I can't mute everybody because I don't know how to. So please mute yourself.
North Eldridge Parkway, forgot the mile.
I'm gonna turn this off if you guys can't mute yourselves. All right, so welcome to our presentation. Okay. All right, Milan, thank you for, can you help me mute everybody, Milan, because I don't know how to do this. But welcome to Replenish, guys. Today we're going to talk about semaglutide. It's a hot button topic around the United States. It's a really cool for weight loss. It's pretty good for diabetes. Clinical trials that showed that it's comparable to the other GLP-1 agonists, but it's really, really good with weight loss. And so let's talk about that a little bit more. Okay, I'm going to share my screen.
Your beans?
If you guys can mute yourselves, please. Oh, Robin, under managed participants. Oh, wow, yeah. Hold on. Oh, man. Yeah, Jordan, I should just Google it, but I think Robin just showed me. Hold on. Manage participants. Boom.
What the fuck?
Stop cussing. Only I can cuss. Or mute all upon entry. Thank you. Please. Nope. Ooh, got him. All right, cool. All right, so I'm going to. Are you still talking? Mute. 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 We're wasting a lot of time, guys, because you guys are not muting yourselves. So just, you guys want to be here for how long? 2 hours? Okay, cool. All right, we're gonna try to keep this pretty short, 30 minutes to 45 minutes, and then we'll, ask some questions after. But pretty much the gist is we're going to tell you about semaglutide. We're going to talk about um, how to start the conversation with semaglutide, speak to your clients about semaglutide without you prescribing it, and then how our team can, even if you're a non-medical provider, how we can take care of the prescription and prescribing, and then you can still benefit from having semaglutide clients. Okay, we're going to talk about protocols. We're going to talk about follow-up. First, let's talk about a little bit about the education part. What is semaglutide? All right. All right, let's see. I guess I'll share my desktop. Can you guys see my desktop?
Yes.
Yes.
Yes. Yeah, we can.
Great, great, great. All right. So let's talk about semaglutide. We'll just talk about this very briefly. I've already made this presentation, but let's just kind of go through it really quickly. Okay, semaglutide, of course, is a great modality of treatment for weight loss. We're gonna really just talk about the indications, contraindications. For weight loss, it is an off-label use. Okay. Mute yourselves, please. All right, so it's a GLP-1 agonist. Okay, it's also known as Wegovy and Rybelsus, Ozempic. You kind of know it probably more as Ozempic. They're GLP-1 agonists, like we talked about, that help regulate glucose. It was originally designed for type 2 diabetes. They did clinical trials and showed that more than half of the people lost about 15 to 20% of their weight, which is pretty significant. Okay, so GLP-1 agonists, receptor agonists, they mimic GLP-1, which is called glucagon-like peptide. We're not going to get into the science part of it because I know there's a lot of people on here that are non-medical providers, but we'll just kind of loosely get into it. Okay, you don't really need to know what incretins are, but we'll have another one of these meetings for just providers. Okay, but just know that it helps to regulate your glucose metabolism. Okay. The indications for semaglutide are BMI of 30 or greater and 27 or greater with comorbidities. A lot of people in the aesthetics and wellness space, especially in the aesthetic space, they really use it even if they have a BMI of like 22 or 23. A lot of people use it to get more aesthetically pleasing. It's a kind of a gray area. So as your clients, you can kind of pick and choose, especially if you're a nurse practitioner. If you're not a nurse practitioner, we can kind of talk about that. I'll give you an example. I have a client who is was trying to get ready for a competition, and really, I mean, really didn't need to be on Mounjaro, but they are on it and lost the weight that they needed to get to competition size. Okay, so some of the comorbidities are hypertension, of course, type 2 diabetes. Contraindications, the main contraindications, the main reasons why people cannot start on semaglutide is a personal history of medullary thyroid cancer. Okay, so it's not just regular thyroid cancer. Even though if they had thyroid cancer, we would still try to do some type of investigation, medullary thyroid cancer. And then also multiple endocrine neoplasia syndrome, type 2. It's called MEN2 syndrome. Okay, they're just a group of hereditary tumors, endocrine tumors. Okay, and I mean, either your clients will know that or not. It's not like, you know, it's not something that you can just miss, I guess. Okay, so some of the off-label uses, of course, weight loss is one of them. That's what we're going to be talking about more today. And then non-alcoholic fatty liver disease and PCOS. Those are two pretty good off-label use. Also, during a lot of the clinical trials. So by the way, this is how clinical trials work. So they find a side effect of the drug, right? And then they try to explore that specifically. And they do all this nerdy stuff to figure out, hey, let's isolate this and let's see how we can make money off of it. So semaglutide is a huge thing now. I forgot who the pharmaceutical company is, but I think it's Nordisk, but Eli Lilly has Mounjaro. They've been, they're going like head to head with the clinical trials. And so they'll start doing stuff like, oh, okay, well, semaglutide is better than Mounjaro, or Mounjaro is better than semaglutide because it also helps to reduce heart attacks and strokes. They're the same type of drug, so they all have the same effects. It's just that when you're doing clinical trials, you can actually kind of target what effect you're looking for. So for instance, Jardiance and Farxiga are two SGLT2 inhibitors. And they pretty much do the same thing, but a lot of people, especially nephrologists, like Farxiga because it has the chronic kidney disease indication. So, but Jardiance also has, that same indication, but it just hasn't, I don't know if they've done the clinical trials for it. Okay, so same thing, semaglutide may confer renal protection. Okay. All right, so we're going to be talking about the protocols and the costs within the SOPs that we're going to talk about. Okay, and then we're going to also talk about follow-up. We've simplified the process of the consult where you're not even doing a consult. You're just sharing a link with them, and the link is an adaptive form, and so it'll do the consult for them. We're going to do the medication review. All right, so let's talk about the SOPs, and then we will get into more of the nitty-gritty about semaglutide. Okay, so again, semaglutide is a GLP-1 agonist. You don't really need to know that if you are not a nurse practitioner or a physician assistant, MD. But just for your education, if you're a nurse, if you're an LVN, MA, esthetician, you do want to know what semaglutide is, how it works. It works by binding to receptors in your gut and in your brain. In your gut, when it binds to the receptors, it slows down your gastric emptying. So it makes you feel fuller longer. And in your brain, in your hypothalamus, it works on your hunger centers. And so it makes you not want to eat. Okay, so we're going to talk about the SOPs. So beginning the visit, let's say that you had a friend or you have a social media post or a website and you have leads coming in, right? And they're interested in semaglutide, okay? So you want to make sure that before you start anything that they have consents, which with Replenish, we're going to provide that for you. And then make sure that they're fit for treatment, right? So if they are unstable, right? And if you don't know what unstable is, you can always, you should ask the provider or you can ask me directly. Okay. So you just let them know, hey, Mr. So-and-so, Mrs. So-and-so, do you know if you have a family history of MEN2 syndrome? We just talked about that, or medullary thyroid cancer, or chronic constipation, gastroparesis, which is delayed gastric emptying. Okay, so those last two can exacerbate one of the side effects of semaglutide. So we have to kind of be careful about that. But again, if you're not a medical provider, they're gonna be asked these questions in the form that we're gonna talk about. And so you don't have to worry about that. But one thing you do have to worry about, no matter what you are, is that we want to be able to measure what is going on. So we want to measure at least their weight and height, right? So we can get their BMI. We want to make sure we follow that and trend it so that we can know if the semaglutide is working, right? There are a lot of compound pharmacies that are terrible. So we want to make sure that we're working at all times with compound pharmacies that do third-party testing. So Empower is one of the major pharmacies that does that. Recently, one of my nurse practitioners talked to me about a Hollandale pharmacy, Florida. Florida has all the compound pharmacies. They have Create. They have a lot of stuff. And then in Katy, there's a pharmacy called Stryker Pharmacy that's good as well. Okay, the vital signs are only good if you believe that your patient is or your client is unstable. Okay, and then we want to make sure that they're not breastfeeding or pregnant. Okay, so the part that you guys are gonna want to study, and we'll share this this page or these SOPs with you guys. You want to study this part because you want to know whatever you do, whether you are somebody that does eyebrows or somebody that does Botox or somebody that is a carpenter. You want to be a master at your craft. So if you can memorize these 3 paragraphs, I mean, you're not going to get really any questions. You're going to be able to convince people that, you know, if they are overweight and if they believe that they can become healthier by being slimmer or have less weight, lower BMI, then this paragraph right here, or these 2 paragraphs right here is all you really need. Okay, so we just really talked about it, but you know, again, it was first discovered as a weight loss monster during the clinical trials that they did with semaglutide. They found that the average weight loss was 16% in, I believe, 60 or 70 weeks. Now, that's really significant because think about this. If you have someone who is, let's say, 300 or 400 pounds, you know, even 200 pounds, like 16% of that is a lot of weight. Okay. So we already know the effects of obesity on somebody's life. It's a silent killer. It leads to metabolic syndrome. It leads to many different things. So, and we can talk about that. Okay. Right. So we've just really getting started with semaglutide. Mute your phones, please, or your Zooms, please. We're just really getting started with semaglutide, but we already have over 100 clients in Houston, Austin, Dallas, and San Antonio. We're working on actually getting out of the state, or not getting out of the state, but expanding to other states. But for now, you know, we're in the major cities in Texas. We're gonna get into you know, some of the other major cities, El Paso, Midland. We did try to expand to Lufkin, but it's not, I don't think it's really that big. Mute your phones, guys. Nicole, is that my sister, Nicole?
Oh, sorry. Am I not?
Oh, sorry. Yeah, you're not on mute, but it's fine. I just muted you. I thought that was my sister, Nicole. I was about to say, Nicole, mute yourself, please, now. All right, so the cost per semaglutide is normally, in Houston, it's, if you're getting it from a physician, it's probably going to be around $500. But the market has changed drastically in the past year. So we can, you know, do about $300 to $500. Just depends on your clients, really, and depends on the market. In Dallas, it may be still that high. In Austin, probably not as much, you know. And in Houston, if you're getting it from a plastic surgeon, then it's probably that high still. If you're getting it from somebody else, like myself, it's probably not going to be that high. So we can kind of play around with the numbers. Yeah. Okay, and then we're offering a very low who is Viola Marshall? Like, what are you doing? All right, cool. We're doing a first month promotion All right, we're gonna go as low as 200 for the first month. We just really want people to try semaglutide if they need it, because again, this is one of those things where it's not like a multi-level marketing thing where you have to convince people, hey, look, this travel thing is great. No, it's like it actually really works. So this is something that you can kind of hang your hat on. Okay, so and that monthly cost is a total of 4 injections, because there are some months where there's like 5 weeks or whatever. Somebody tried to do that to get me on that, so yeah. Okay, and then after that, after the cost is not an issue anymore, the intake form is just really easy. And I'm gonna click on it so you guys can kind of see. Okay. If you don't catch any contraindications to semaglutide by talking to your clients, by the way, if you're gonna do anything, you have to be able to talk to people. So that's just off top. If you can't talk to people, you're not gonna be able to do the replenish business model. But you can practice it, of course. You can learn how to do it, but just know that. Okay. So we've created this. Sorry for this green line. Whoever was that Marshall, whoever that is, she kind of just did that. Great. All right, so we have this very short presentation that you can actually just give it to your clients after they have paid their fee, and you will keep up with your clients' payments. Or you can read this to them. I created it just so that it'll be really easy to kind of do. All right, first name, last name, email, phone. Oh, that's my personal phone, so you guys can talk to me more if you're interested in anything that we are offering, whether it is semaglutide or whether it is joining as a replenish provider. Okay. That's not how old I am, guys. I am getting old though. I just had a birthday. I feel so old. All right, so I am male. Let's see, my height. Okay, so my height is, let's say that I'm 6'5", and let's say that I'm 200 pounds. I'm not though, obviously. All right, so it's gonna talk to you now as if it knows who you are. Kelechi, have you heard people say that weight loss is simple math, calories in minus calories out? It's not, and it's gonna kind of explain that to you. You guys can get this link so you can go through it as well. All right, and then it's gonna ask you if you're being treated for any of these. And so the way this works is, let's say that they put blood pressure or ED. You as a non-medical provider, or even as a medical provider, but an RN, or you may not even make a a a link between sleep apnea and whatever else. You don't worry about that. What we're gonna do is we're gonna see this on the back end and say, okay, maybe this person can get labs, right? A lot of times people are not losing weight for many different reasons. A lot of times people are having erectile dysfunction for many different reasons. Sleep apnea is a huge, 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 huge deal. Okay, so some people, I'll give you this one story and then we'll move on. There was one of my patients, um, I suspected that they had sleep apnea, and maybe it had gone on for like a year. We had to put them on 4 different blood pressure medications, and it just seemed a little bit refractory. We discovered that they had nocturia. They were peeing at night a lot. And there's a link between nocturia and sleep apnea that, a lot of people, I mean, people know it, but, it's like if you're a urologist, you know it. But pretty much as you have these apneic events, like when you gasp for air, sometimes it happens 2 times a night in people, and sometimes it happens hundreds of times a night. You have this thing called anterograde amnesia. So you don't really know what's going on when you go to sleep or when you wake up most of the time. So you can be having these apneic events plenty of times, waking up and getting terrible sleep. But as they happen over and over and over and over, it actually increases your systemic vascular resistance and puts a strain on the right side of your heart. Your body or your heart produces a substance called ANP. atrial natriuretic peptide, and then it's a diuretic. You go to the bathroom. That's why people use the bathroom at night when they have sleep apnea. Okay. So that's just a little tidbit. But the person didn't really want to get a sleep study, even though they made it very convenient. You don't have to actually go to a lab most of the time anymore, except if you have Medicaid, sometimes they make you go to a lab. You can do a home sleep study test. If you're diagnosed, there are many different options. If you have moderate sleep apnea, you can get a mouthpiece that a dentist can create, or a CPAP. If it's severe, you need a CPAP. But they didn't want to do that, and they ended up having a stroke. So there's a lot of things that, we can help with, even if they don't, by just filling out this one mini form. And we'll be adding a little bit more to the form as well. But also, if they have like ED or low T or low thyroid, that's something that they want to check out, because if you're not losing weight, you can just fix your sleep, or you can fix you can't fix your heart like that, but you can fix your testosterone, or you can fix your thyroid, right? So there's a lot of things that we can kind of do by just filling out this form. Okay. Okay, and so it's going to ask if you had recent blood work. Now, we don't really need to have blood work in order to get you started. The only thing that I'll say is, a lot of times if people have insulin resistance, and insulin resistance starts before prediabetes. Prediabetes is when your A1C is at 5.7 to 6.4. And then if you're 6.5 and above, you have diabetes, pretty much. If your hemoglobin is high or low, sometimes that can affect it, but pretty much this is what it is, pretty much. But insulin resistance starts before 5.7. It's a gradient. It's not like a black and white thing. Okay, so if you can help the insulin resistance before that, I mean, I definitely would do that. For instance, an insurance company will not approve of Ozempic typically if they have prediabetes, but and you can change your lifestyle, but most people are not going to be disciplined enough to do a drastic change of their lifestyle. So I actually have a lot of people who have prediabetes on semaglutide, but off label, not through their insurance. Okay, so we don't need it to start, but if they're not losing weight, it may be because maybe their dose is not high enough because they have insulin resistance. Okay, so let's just say yes, whatever. All right, so if they do want a full set of labs, great. They don't, great. Okay, and then here we break down insulin resistance, and this is something you can talk to your clients about. I've talked about it before. I always say the same thing, right? It's not as simple as this, but pretty much when you eat carbohydrates, even if you eat fats or if you eat protein, if you're not getting the proper ratio, your body still turns it into sugar. So think about that. I know that, people say, oh, I need protein and yada, yada, but if you're not getting the proper amount of the ratio, your body's still going to turn the food you eat into sugar or glucose. So as you eat, your brain stimulates glucagon, it increases the glucose in your blood. All of your cells want to grab that glucose and put them inside the cells because it powers your cells, right? In order to do that, you need insulin to attach to the cells. So your body, being as efficient as possible, or attempting to be, it will release insulin from the pancreas, right? And then those insulin will attach to your cells, and then it will go grab the glucose in the blood and then bring it into the cells. In a perfect world, you can do that all day, right? But it's like an engine. It's not a perfect world. There's no such thing as a perfect engine. So as that happens more and more and more, eating pizza, eating tacos, eating whatever you want to eat. I don't know what you eat. Pho, whatever you eat, right? It'll fail eventually. So you have to do things to maintain the engine, just like in your car, right? And some of those things are, of course, changing your diet, eating more protein if you don't have any kidney issues, eating less carbohydrates, and then, of course, doing a lot of resistance exercises. Okay, so lifting weights, running and cardio is good too, but more of the exercises that are going to break down your muscles, and when that happens, it's like your body, it's a magnet for glucose, so that really helps. So let's see. So that is our spiel about insulin resistance. It's like an engine. So you can explain that to your clients like that. Okay, so have you tried to lose weight before? Duh. Everybody's tried to lose weight. Okay, what's preventing me from losing weight? Lack of discipline. So that's great actually, because with semaglutide, it's one of those things where you can kind of cheat, but it's not really good too, because obviously if you stop semaglutide, you still have the bad habits, you're gonna gain weight back, right? So you want to still, as you are losing weight, still try your best to gain healthy habits. Okay. Intermittent fasting. I know everybody's tried that before. It kind of works sometimes. One thing that you do have to, when you're trying to lose weight though, is if you are constantly going underneath the calories that you are supposed to eat at, your body will respond. Your body is very efficient. So it's gonna respond though, as if you are, let's say you're trying to eat 1,000 calories, but you really need 2,000 calories a day. In order to lose a pound a week, you just need to lose 500 calories per day, or eat or eat 500 less calories per day, because you need to lose 3,500 calories. If you're doing the math, 3,500 calories a pound. All right. But if let's say you want to eat 750 calories, all right, your body is going to eventually believe that you are 75 pounds. So your metabolism is going to slow down to that of somebody who is that weight. So that's why a lot of people, when you go to personal trainers or dietitians, people are not losing weight because they're not eating enough calories. That's the reason why. So if you are, let's say you have to calculate your basal metabolic rate and stuff like that. But let's say you require 2,000 calories to maintain your weight. If you drop down your calorie, let's say you drop down your calories to by 250 or 300, you then now need to work out to make up the 500 calories per day to lose the 1 pound a week. So the goal is to try to lose 1 pound a week. So either you can do it by diet or a combination of diet and exercise. Or if you want to go balls to the wall, you can, lose 2 pounds a week. But again, just remember that you still need to at least be eating protein. All right. And that's really hard it's really hard because you have to start eating like a whole bunch of chicken breasts and a whole bunch of crap that's like, oh my God, too much food. All right. So then one of the other most important things with weight loss is your activity, your non-exercise activity, actually. If you're a healthcare provider, a lot of nurses believe that they're really active because you gotta stand up a lot. I'll give you that. But that's not what we mean by active. Let's say I'm a tugboat, not quite, whatever. I'm a nurse. All right, so okay, now it's going to talk about, let's talk about semaglutide, which we've already talked about, so we don't really have to actually go into it. Then it just asks for the medication they're on, any allergies. Okay, so semaglutide, we've already talked about it. You can talk about it with your clients again. Here are some of the side effects, very simple side effects. The way we have our protocol, we'll talk about that. We really reduce the side effects because we do it slow and steady. It's a marathon for us, not a sprint. Okay, and then that's pretty much it. And then our medical director is going to review this, and then that's it. So that consultation, even though I was explaining things, it's not going to take that long. It'll take like 10 minutes if you actually just going through it. Okay. So the intake review, the intake form, we will do the medical review. It's really simple. And then after this, now this part is for the providers who can actually prescribe. If you're a nurse and MA, all you're gonna ask us is, hey, Dr. A, what should we start with? And then we'll record it and you'll record it. And then the next time they need a dose increase, we'll look at the previous dose and then we'll increase it like per our protocols. And I follow our protocols as well. Okay, so now there are a few problems sometimes that I see where providers are just going by the units that somebody is on. And that is not that's not the way that you calculate somebody's dose. Okay. In order to calculate somebody's dose, you really need to use stoichiometry, or you can just kind of memorize what's going on. And I'm not going to even talk about this unless you're a provider. We can talk about this as a provider, but just know that you need to get the strength, the milligrams of how much semaglutide they're on. Okay. And so our protocol is really simple. You just pretty much go up by 0.25 every 4 weeks. All right. And then we will adjust it based on if they're already on semaglutide, if they have known insulin resistance, right, or their clinical picture. So after, let's say they're on 0.5 milligrams of semaglutide and they're just like not losing weight, they still feel really hungry, and things like that. Either we can start trying to figure out, hey, does this person have insulin resistance or diabetes, or we'll just increase their dose. Okay, so we'll do, if it's safe to do, we'll do it. Wegovy's protocols are a little bit different than ours, because they jump up a little bit faster, which is fine. But I find that when you do it like this, it's not like a yo-yo thing, and people lose weight safely, and then they're able to kind of get off safely as well. Okay. And by safely, I mean, one of the issues with using units, right, is that you don't know what the concentration is. Like I said, we get our semaglutide from only a few places, but because there's like always a back order, let's say that we needed to get it from somewhere in Dallas, which we would never would, but let's just say I would rather somebody wait a little bit than get it from someone reputable. But let's say you get it from somewhere in Dallas and they don't have the same concentrations as Empower. So now if you're giving somebody the same units, or if you're just going about the units, you may be giving them a larger dose. I have another story about that. That put somebody in the emergency room. They were getting a dose from one provider at 10 units, and then they told, or no, at like 20 units, and they told the other provider, hey, I'm on 20 units. You only gave me 10 units. The provider, without, kind of checking for, the actual, which is negligent, but without checking for the actual concentration, right, of semaglutide, they just blindly gave them 20 units. And most likely, or it was 25 units, most likely the concentration of the first one was the initial starting dose of 1 milligram per ml, and they were on 0.25. But if you gave them 25 units of 5 milligrams per ml, I mean, you gave them a large dose. So that's probably what happened to them. They end up in the ER. So if you don't want your clients to end up in the ER, follow a very simple protocol. Don't make it difficult or complicated. Okay. And so these are just the protocols or directions to inject. Is really simple. You can even YouTube it and figure it out yourself, but these are the instructions. Okay. All right. So, and then the most important thing though is after they are injected is a follow-up, right? You want to make sure that your clients are receiving some type of value from this, right? You don't want to just make them believe that you're injecting them with saline or some bull crap, right? So we want to make sure that they're actually getting some value from this and are losing weight. So the first follow-up, you follow up with them at the end of the week, and then the second follow-up, you follow up with them at the end of the third week. Okay, and there's a reason for that, of course, right? So the process that we've created is pretty simple. Even if you are not a medical provider, all you have to do is pretty much make sure that they're consented. And you don't have to provide the consent. You can literally tell somebody, one of us, to consent them. Educate them on semaglutide. If you don't, feel like talking to them about that, again, that's something that we can do for you. They just need to pay for their consultation and then fill out that form, and then that's pretty much it on the responsibility on their part. Now, we will then take that and review the form, and then we provide a service all over Texas where we can deliver it directly to the patient or deliver it directly to the provider. And the provider can inject at one of our clinics. They can go to the house, however they want to do it. It's really up to the provider. Okay, and then the follow-up. So that is pretty much semaglutide in a nutshell. We can, again, if you're a provider, we can kind of do a more in-depth deep dive into semaglutide and the actual science behind it. But I'm gonna open it up to kind of some questions so that you guys can ask me some questions. If there are no questions, I hope that you guys for sure learned something. And so we're gonna make this process really simple.
There have been questions in the chat.
Oh, okay, hold on, let me see. Yes. What are the stats on rebound weight gain? After it's I don't know the stats, but there is rebound weight gain. So let's say that you started semaglutide and you had a terrible diet, then if you stop it, you're gonna gain weight if you still have a terrible diet, that's for sure. It's like a gastric sleeve. You're not gonna be able to out eat a bad diet. Oh, did I say that right? You're not gonna be able to lose weight on a bad diet. Let's see. Can you make this PowerPoint available? Yes, I can. Well, for replenished providers, I can, so it depends. Increase fiber intake for sure. Yeah, for constipation. Yeah. What would be the markers of insulin resistance? In our case, I mean, there's a lot of, you can actually get actual random insulin. You can get a A1C, you can get C-peptide. Clinically, you can look on the back of somebody's neck and see if they have the nigricans, acanthosis nigricans. Do we have a taper off? Yes, we do have a taper protocol as well. Hello, who's that? Did somebody just whimper? What is that? Oh, Connie, good deal. There you go. That's Connie just gave you some pretty good markers of metabolic syndrome for sure. Good deal. Who is Connie? That's pretty good. Connie, are you a nurse with Replenish?
No. I'm a nurse practitioner. That had a work interview with one of this clinic that he used semaglutide and Manjaro.
Uh-huh.
And I thought it was interesting how I learned things in his clinic. So I was kind of interested in this Zoom meeting because of that.
Okay. Yeah, maybe we can talk after this. I'm glad you actually put that in the chat. That's good. If we're not already provided, what is the process to gain access to this program materials and providers? Allison, we'll have Milan or one of our providers will reach out to you. Or you can, I think you are probably in our Go High level. Just reach back out to us and we'll definitely get you set up for that. And it's not just semaglutide, guys. So if you're a nurse practitioner, LVN, even other things, other professions, if you can do IV therapy, like if you have IV certification, we provide IV therapy for hydration and other things. We also provide peptides for anti-aging. Semaglutide is just one of the peptides that we provide. This is just one of the different modalities of treatment that we provide, but we do BPC 157, We do CJC, Sermorelin, Ipamorelin. We do a lot of things. So this is just one of the modalities that we have. I'm trying to make a series so that people can kind of understand that, hey, look, there's another side to healthcare than just you're using your insurance. Of course, I would love if insurance would pay for something like this, but of course they're not going to. So, okay, let's see. Nisha, you need this? Yeah, I need it too. Taper protocol, we'll talk about that. Leslie, hold on, which Sarah is this? Is this our Sarah? I can't tell which Sarah this is. Sarah's like, kind of, but we'll talk about the taper protocol. If you join Replenish, we'll talk about that. If you're not a part of Replenish. Can you help me get set up as well? All right, cool. Milan, let's see. Are you hiring for physician assistants, NPs? So the way we work is that we're not traditional employment. Even though there are some people who we are contracted with who are an hourly salary, more on the aesthetic side. But for wellness, it's more of that you're building an organization within our organization. And some people are not entrepreneurial, right? And so I totally understand that some people want their the 9 to 5, they want to make 30 to 40, 50, $60 an hour, and that's perfectly fine. But this is something that if you want to kind of build an asset, right, that stays your asset, right? We have people who come in to Replenish, they get big and they hit the road, and those clients stay with them. And so I personally don't care if you leave Replenish, as long as we have added some value to you. So that's kind of the goal for Replenish. All right, so the anti-aging peptides, that's something that we will for sure do. Today is just, again, the first thing. Okay, let's see, Jennifer. Cool. All right, good. All right, so we're gonna, if there's no more questions,
I have a question.
who's that?
Nicole Wolf.
Oh, what's up?
Hi. Hey, so quick question. I do have some clients who are already on semaglutide. They're thinking about switching to tirzepatide. Is
Mhm.
that possible for them, or is that something that, what do you
Yes.
recommend?
Yes, that is, I mean, to be honest with you, tirzepatide is much better
Right.
as far as effectiveness. So yeah, I definitely would. You would just need to convert them, and we can. I mean, I supervise you, so we can talk about the conversion for them.
Okay. And then I have a question. What do you think is the best response to give a client? Because I get this all the time. Obviously, it's an investment for them. People just want to try, I just want to try it out for 30 days. And I tell them, like, you want to give this medication, a shot. It's going to take longer than 30 days, longer,
Yeah. So,
weight loss isn't just overnight, a healthy, attainable weight loss. So what would be an appropriate response to give someone who's just wanting to try it out?
yeah. So the thing is, when they did, even though I actually do have people who make a significant weight loss within 30 days, sometimes, right?
Mhm.
But the norm is you're not going to lose that much weight in the first 30 days. So when they did clinical trials, they showed that, yes, there was a 16% average reduction in weight, but it was over like 70 weeks, right? So
Mhm. You
for
said 70 or 7?
70 weeks. So,
Oh.
but that's just average, right? And those are people
Mhm.
who had like full-blown diabetes. So, it from my numbers, anecdotally, are much better than that, of course, right? I've had people to lose 40 pounds in 2 months, right? But it just depends on how motivated somebody is. But you should at least give the program 3 to 5 months, right, to actually make significant weight loss.
Okay.
You're not going to do yourself any service by investing $300 to $400 to lose weight. You've already tried to do all types of crazy ass diets and intermittent fasting, 1 meal a day, and all types of bullshit like that. You might as well, do it the correct
Yeah.
way. So
Okay. Perfect. Thank you.
not to say bullshit though. You just have to,
It's the truth. Okay. Thank you, Dr. A.
believe. All right. Anybody else? I'm kind of surprised. There was 100 people in this meeting. That's pretty good. All right. So again, reach out to us if you're interested. I know sometimes when we're doing these meetings, it's kind of just like, okay, well, why are you, why are you doing this? It's really because I want to, my goal is actually to grow Replenish nationwide. But of course, I'm starting with Houston or Texas. I don't know what Zepbound is. Okay, so the person who's looking for prescriber because only less than people feel that this and correct, Karen, you can just send us a message and we'll get you going for sure. Stacy, just talk to us and then we're not, so today is not, I know that you guys, I knew that there was gonna be a lot of interest in this once you kind of understand fully, but we'll talk to you about any type of investment or anything like that. We don't want to make today about money. It's just really about the education. But if you guys don't have any more questions, I appreciate your time. Thank you guys. And I'll record this and I'll let you guys kind of read this, and I will share, if you reach back out to us, I will share the PowerPoint. Education should be free, so don't worry about that. Okay, guys, thank you so much.
Thank you.
No problem.